Good afternoon, everyone. Take this off. My name is Mark Rice. I'm the Senior Director of Clinical Services at Ontario Shores, and I'm joined by Dr. Danielle Halusik, the President of our Medical Staff Association. It is our pleasure to celebrate recovery with the presentation of the 4th Annual Dr. Ian Daw Recovery Award. Typically, the Dr. Ian Daw Recovery Award is presented in June at the opening of our Recovery Art Show. Unfortunately, we're not able to gather and celebrate recovery as we have in the past. Despite the challenges that the hospital and the community have faced, we are honored to use this all-staff forum to celebrate the many contributions made in the name of recovery at Ontario Shores. The award is named after Dr. Ian Daw, the former physician-in-chief at Ontario Shores, who was a leader of recovery during his time here. I'll now turn it over to Dr. Halusik, who will recognize the 2 finalists before announcing this year's recipient.
Hello, everyone. Thank you, Mark. I'm honored to recognize these contributions as we present the annual Dr. Ian Daw Recovery Award. The award is presented by Ontario Shores in partnership with the Medical Staff Association to recognize a staff member who puts the principles of recovery into practice and has had a positive impact on a patient's recovery. We received nominations from patients, family members, and colleagues, which shared how particular staff members have impacted their recovery journey. Nominees were considered for the award based on their ability to do the following: act as a champion for collaborative planning and goal setting, focus on abilities and strengths, making their patients feel good about themselves, instill hope, helping to identify opportunities towards a hopeful future, see a patient as a whole person, empower patients to make choices and take control in their recovery journey, provide opportunities for connection. Our selection committee was overwhelmed with the quality of the nominations. I want to congratulate everyone who was nominated for this prestigious award. The number of nominees we were given goes to show you how much recovery is embodied in everything you do. Our first finalist is Dylan Zambrano. Dylan is a social worker in outpatients who was nominated by a patient. This patient noted, "He made me look at myself, my truths, my flaws, my values, my feelings, my emotions, and my dreams, and everything else that was buried under my PTSD. He taught me to be kind, compassionate, forgiving, and not because others deserve it, but because I deserve to have a life of happiness." Congratulations, Dylan, and thank you for your ongoing commitment to recovery and dedication to our patients. Our second finalist is Leah Johnson, a peer support specialist who was nominated by both a patient and a colleague. Among other areas, Leah has supported patients on our eating disorders unit through some of the most difficult times of their lives. She exhibits empathy and compassion to help young people navigate through recovery. Her attitude and spirit are infectious. A patient on EDU noted, "Leah always does whatever she can to make someone's day better. I honestly don't know where I would be without her." Congratulations, Leah. You are a true ambassador of recovery. I am now pleased to honor the recipient of this year's Dr. Ian Daw Recovery Award. This individual received an astounding 26 nominations for this award as a result of her contributions as an RPM on EDU. Described by colleagues as patient-centered, with an ability to harness the personality and character of a patient in creating meaningful recovery goals, this individual is viewed as a role model of ethical and just leadership. As one colleague noted, she sees her clients as a whole person rather than statistics. She is able to provide support and emotional coaching to work with daily life events. She helps clients discover their own mastery, belonging, and independence. It is my honor to announce that this year's recipient of the Dr. Ian Daw Recovery Award is Shannon Gillies, RPN on EDU. Congratulations, Shannon, and thank you for leading the way in recovery-oriented practice.